All the articles you have come to love in Equus magazine are now available in this podcast, Equus on Audio. Each article is released as its own separate episode to make them quick and easy to listen to. Search Equus on Audio to subscribe on your favorite podcast player, and you'll never miss an article.
You can enjoy your favorite equine videos all in one place with Ride TV, the ultimate equine streaming platform. The newly relaunched Ride TV has all the series you love, like mini horses and ridiculous ranches, plus top-tier training videos and event footage from Horse and Rider On Demand and barrelracing.com. Live the action, learn from the pros, love the stories. Subscribe to Ride TV today for only $19.99 to see where your ride takes you. Visit ridetvgo.tv to subscribe.
This article was posted on October 8, 2024. It was written by Lori Bonner and is titled Quick and Easy Scratches Relief. Scratches is the common term for pastern dermatitis, an inflammation of the skin that develops between the heels and the fetlocks. Affected areas become scabby and crusty, sometimes using clear or yellowish serum. Usually the result of repeated wetting and drying. Scratches develops when bacteria or fungi invade through tiny wounds or cracks in the skin's surface. Although scratches can occur at any time of year, it is seen more frequently when horses are turned out in wet environments. You can probably treat scratches on your own, and most cases will clear up quickly with proper care. But if your horse develops persistent or severe scratches, you'll want to seek your veterinarian's help. Here's what to do for scratches. Number 1. Rinse your horse's legs. Move your horse into a dry area and hose off dirt, mud, and other debris on his lower legs. You may want to carefully trim the longer hair on his pasterns to better expose the skin to the air. Number 2. Cleanse the affected area with an antiseptic wash. Choose a product that contains 2% chlorhexidine or benzoyl peroxide, and use it as directed. Avoid products with higher concentrations of these agents because they can further irritate the skin. Number 3. Dry the skin thoroughly. You may want to use a hairdryer at a low setting. Number 4. Apply an antibiotic ointment. This step isn't strictly necessary, but in addition to helping to kill bacteria, a thicker ointment may form a protective barrier over the skin. Number 5. Repeat as needed. Clean and treat the affected skin every 2 to 3 days until the infection clears. Most cases heal within 2 weeks. Number 6. Address the cause. If your horse develops scratches after spending too much time in wet turnout areas, you may need to find him a drier paddock or pasture. Also consider longer-term solutions, such as laying down gravel in chronically wet areas or taking other steps to improve drainage. It may take some detective work to discover the cause. Scratches may develop when a horse's skin is chronically irritated by bell boots that don't fit or environmental conditions such as coarse arena footing. In other cases, the skin is irritated by chemically treated bedding materials. Call your veterinarian if or when the infection grows worse despite treatment or does not heal within 2 weeks. Your veterinarian will want to rule out other conditions such as vasculitis or mange, which can look very similar to scratches. In addition, a prescription medication or a different treatment may be needed if the infection proves to be fungal rather than bacterial in origin. The affected legs start to swell. If pathogens penetrate the outer layers of the skin, a serious infection of the deeper tissues may result, leading to painful swelling. You'll want your veterinarian to begin treatment promptly. The infection recurs persistently, despite treatment and changes in the horse's living conditions. Some horses are just more prone to scratches, but if yours seems to be constantly affected when others around him are not, your veterinarian will want to investigate the reasons why. One possibility is that your horse has an underlying disorder that affects his immune function.